Hello dear student, I am Sakshi Sharma working as an assistant professor in NIT Pharmacy Institute. Today I am going to teach you antipsychotic, antidepressant and antimanic drugs. So we shall proceed. First one is antipsychotic drugs. Okay, what are antipsychotic drugs? Antipsychotic drugs, these are also called as the neuroleptic drugs or the major tranquilizers. Okay, and they are mainly used to treat the schizophrenia condition. Schizophrenia, it is a biological illness conditions. Okay, and these antipsychotic drugs, they are mainly used to treat the psychotic state. Okay, the psychotic state or any of the mania state. Mania states means the mood disorder conditions. Okay, which psychotic, any of the person which are suffering from any of the psychotic symptoms, these antipsychotic drugs are mainly used to treat these conditions. Okay, now antipsychotic drugs, they are not curative and do not eliminate the chronic thought disorders, and they are often decreases the intensity of hallucinations or delusions, or they will permit the person with schizophrenia to function in the, they can so the person can mainly work in a supportive environment. Okay, now first of all we have to study what is psychosis. Okay, what are the disorders mainly include in the psychosis. There are several psychotic disorders. It is mainly a serious distortion. The main individuals or the person, they are mainly suffer from the serious distortion of the thought or emotions. Okay, and there is a distortion of the behavior conditions also, and the individual are not able to recognize the perceptions. Okay, and this is insensible and misperception, or you can say that it is a misevaluation condition, and this patient is not able to meet the ordinary demands of the life. Now there are mainly the types of the psychosis. There are mainly three types of psychosis. First one is the acute or the organic brain syndrome psychosis. Second one is the functional disorder psychosis. It includes the paranoid stress and the schizophrenia. Third one is the mood, which is known as the affective disorders, and it includes the mania and the depression. As you guys already know what is mania. Mania, it is a mood disorders, and depression, the person which is depressed. Okay, now antipsychotic drugs, first of all we have to study what is the acute and organic brain syndromes. This mainly includes, there is a delirium or the dementia condition, there is a memory loss condition will be there. The causes, what are the various causes, what is the main causes includes in the acute or the organic brain syndromes. There is a exposure of, due to some of the exposure of some toxic substances, or you can say that due to the exposure of pathological changes will happen in the body. This mainly causes the acute or the organic brain syndromes. Okay, there is a prominent features which includes in acute or the organic brain syndromes. This includes the confusion, the disorientation, or the defective memory. Okay, the memory, in the memory there is a defection will be occur. Now second one is the functional disorders. Okay, now what are the causes of the functional disorder? They are not underlying causes can be defined under the functional disorders. There is a memory or the orientations are mostly retained in this condition, but emotion, thought, reasoning and behavior are seriously altered. The patient memory, emotion, thoughts and reasonings and behavior condition, this is seriously altered in the functional disorders. Now what is psychosis? Psychosis, these are the schizophrenia or the paranoid states. What are schizophrenia? Schizophrenia, if you talk about the schizophrenia condition, schizophrenia, it is a particular type of psychosis. Psychosis, it includes the mental disorder, the mental illness, you can say that, and it mainly caused by some of the inherent dysfunction. When there is a dysfunctioning occurs in the brain system, it mainly causes the schizophrenic condition in that individual, and it is mainly characterized by the delusions, hallucination will be occur in the patient. Okay, and it is often in the form of the voice. There is changes in the thinking or the speech, or there is a disturbance in the mental condition, and this is very common disorder, and it is up to, if we talk about the prevalence of this disease, this is mainly occur about 1% of the population. Now, we have to talk about the what are the various drugs which mainly includes or which mainly used to treat these psychotic conditions. Okay. Now, this is the classification of the drugs in which we are dividing the drugs into two generations. First one is the first generation antipsychotic drugs which have the low potency, and in another the first generation of the antipsychotic drugs which have the high potency. Okay. And the second one is the second generation antipsychotic drugs. Okay. Now, in the first generation antipsychotic drugs, we have to study some of the drugs which may have the low potency, like chlorpromazine, prochlorpromazine and thioridazine. Okay. These have the low potency drug. Okay. They have the low potent. Second one is the first generation antipsychotic drug which have the high potency, and these drugs have the high potent. Okay. These mainly include the flufenazine, haloperidol. It is a very important drug, haloperidols. Okay. Pimozide and thiothiazine. These are the first generation antipsychotic drugs which have highly potent drugs. Okay. Now, the second generation antipsychotic drugs mainly includes the aripremazoles, okay, clozapine and risperidone. These are the drugs which comes under the category of the second generation antipsychotic drugs. Now, we have covered the we have covered the classification of the antipsychotic drug. What are the various drugs which mainly include in this condition? Now, what are the mechanism by which they mainly produces their action? Now, if we talk about the first generation of the antipsychotic drug chlorpromazine, the mechanism of action of chlorpromazine is that all of the antipsychotic drugs, okay, the drugs which mainly comes under the category of antipsychotic drugs, they mainly act on the dopaminergic receptors. Okay. They mainly block the postsynaptic dopaminergic receptors. Okay. If we talk about the mechanism of action of antipsychotic drug, they mainly block the postsynaptic dopaminergic D2 receptor. They have to block the D2 receptor in the mesolimbic and the cortex region of the brain. Okay. And they are mainly act as a competitive antagonist of the antagonist. Why we are talking about the antagonist? Because they mainly inhibit this D2 receptor. That is why we are talking that these are the competitive antagonists of the dopamine receptors. Okay. Because these drugs mainly inhibit or block the dopaminergic receptors. Clear? Now, the blockage of the D2 receptor is thought to be a response. If we are thinking that due to the blockage of these D2 receptors, they are mainly responsible for decreasing some of the symptoms of the schizophrenia. Now, what are the pharmacological action? Because we have in the earlier in the previous slide we are talking about the chlorpromazine. Now, what are the pharmacological action of these chlorpromazine in the different organ? First one is the cardiovascular. Okay. In the cardiovascular, these drugs mainly produces the hypotension condition. They mainly decreases the blood pressure. Okay. They mainly produces the reflex tachycardia. Clear? Now, the second is the CNS. What is the effect of these drugs in the CNS part? Means central nervous system part. Okay. They mainly produces a drowsiness due to the blocking of D2 receptors. They mainly produces a drowsiness in the patient. They mainly reduces the motor activity. Some of the motor activity they will get reduced in the due to these chlorpromazine drugs, and they reduces the aggression. Aggression can be reduced. Okay. Impulsiveness can be reduced. Now, what is the effect in the kidney? If we talk about the kidney, there is a depression of anti-diuretic hormone, ADH hormone. There is a depressed the secretion of these ADH secretion, they will get depressed. Okay. Now, the endocrine system, what is the effect of the endocrine system? Now, they will induces the lactation. The lactation it will get induced. There is an impaired glucose tolerance get impaired. Okay. Now, chemoreceptor trigger zone, as we all know that the CTZ, CTZ, due to the stimulation of these CTZ receptor, they mainly produces the vomiting. Okay, now due to the trigger of these chemoreceptor trigger zone, because these chlorpromazine drug, they will act on the CTZ receptor, and due to the stimulation of these CTZ, they will induces the vomiting. Okay, they will increases the vomiting condition. Now what are the adverse effects? If we talk about, because all of the drugs which we are consuming, there is the, if the therapeutic effect will be there, there are some of the adverse effects are also there. Now what are the adverse effect or the side effects, we can say that what are the side effect of these drugs. First one is the constipation will be occur. There is a retention. I have told you that there is increase in the ADH, there is increase in the ADS secretion get reduced, due to which there is a retention of the urine, retention can be there. There is increase in the heart rate, because they will increases the reflex tachycardia, that's why they will increases the heart rate, it will get increased. There is some of the Parkinson like syndromes will be there. Okay, dystonia condition will be there. There is neuroleptic malignant syndrome will be there. Now what are the uses? If we talk about the therapeutic uses of these antipsychotic drugs, they are mainly used to treat the psychiatric condition. Now what is psychiatric condition? Psychiatric condition को हम लोग दूसरे टर्म में बोल सकते हैं mental illness. These psychiatric conditions are also called as the mental illness. Means these antipsychotic drugs, they are mainly used to treat some of the mental illness like the thought, behavior. Okay, they are mainly used to treat the psychiatric condition of the patient. Second one, the therapeutic activity and the therapeutic use of these antipsychotic drugs, that they are mainly used to treat the chronic alcoholism and Huntington disease. What is Huntington diseases? Okay, this is also called as the inherited condition. It is an inherited condition in which some of the brain some of the nerve cells in the brain, they will get, there is illness of the brain part. This is known as the Huntington condition. There is a distortion of the thought, there is distortion of the behavioral will be occur. Now these are also used to treat the high cough conditions. Okay, these are mainly used to treat nausea and the vomiting conditions, also pruritus condition. Some of the neuroleptigenia conditions are also there, which are mainly treated by the antipsychotic drugs. Now we have talked about the chlorpromazine. There are some other antipsychotic drugs are also there, like haloperidol, clozapine, risperidone, amisulide. These are the some of other antipsychotic drugs. Okay, and all of the antipsychotic drugs mainly act on the D2 receptor. They will inhibit, they will block the D2 receptor, dopaminergic receptor in the mesolimbic area. Okay, now the haloperidol, they will also block the dopaminergic D2 receptor. This is the MOA, means the mechanism of action of haloperidol. And what are the uses? They are also used to treat the acute schizophrenia condition. Some of the Tourette syndromes are also treated by haloperidol drugs. Okay, and adverse effect, if we talk about the adverse effect of haloperidol, they are mainly produces some of the hypersensitivity reactions, allergic reactions can be seen by consuming the haloperidol drugs. Okay, some of the endocrine disturbance will be there. Now the second drugs is the clozapine. They will also block the D1 and the D4 receptor, means the dopaminergic receptors. They will also block the dopaminergic receptors, D1 and D4 receptor, and they have a less affinity for the D2 receptors. Okay, because dopamine receptors are subtypes are D1, D2, D3, D4. Okay, so all of the antipsychotic drugs, they mainly act on the dopamine receptor, and they will block the dopamine receptors. Okay, but these clozapine, they will act on the D1 and D4 receptor, and they have a less affinity for the D2 receptor. Okay, now If we talk about the uses of the clozapine, they are mainly used to treat the mania condition, Tourette syndrome, same as with the haloperidols. Okay, the adverse effect of these clozapines are agranulocytosis, where sedation will be there. There is a weight gain will be there. Hyperglycemia condition will be there. There is increase in the glycemic conditions. Okay, now risperidone. Risperidone, they will also block the serotonin 5S2, 2A and D2 receptor. Okay, they are mainly used to treat the 8 typical antipsychotic drugs, and they are mainly adverse effect on nausea, anorexia and agitations will be there. Okay. Now, second one is the depression. What are depression? Depression, if we talk about the depression condition, depression, it is a common psychiatric disorder, and the main etiology, if we could talk about the causes, they are not clear. Okay, depression are mainly two types, unipolar and bipolar depressions. Okay, clear. Unipolar, if we talk about the unipolar, due to some of the stressful and the distressing circumstances in the life, they causes the unipolar depression, and bipolar is characterized by the period of some of the mania and depressions. Now, classification of the depression, they are mainly classified tricyclic antidepressant, in which there is imipramine, desipramine and clomipramine drug will be there. Atypical antidepressant, mineserine, amintapine and bupiron will be there. Selective serotonin reuptake inhibitor, fluoxetine and some of the serotonin norepinephrine reuptake inhibitor will be there. Some of the MAO inhibitors will also be there. These are the classification. Now, if we talk about the mechanism of action of antidepressant drugs, first one will talk about the selective serotonin reuptake inhibitor. These selective serotonin reuptake inhibitor, they will block the reuptake, because as the name indicate, the selective serotonin reuptake inhibitor. Okay, so they mainly block the reuptake of the serotonin in the nerve ending by inhibiting some of the serotonin transporters, and they will increase the serotonin receptor, and they will produce the antidepressant effect. Some of the adverse effect are nausea, vomiting, insomnia, and they are mainly used to treat the antidepressant. Tricyclic antidepressant, they are also block the reuptake of the serotonin and norepinephrine in the presynaptic terminal. The adverse effect are sedation, confusion, sweating will be there, and they are also used to treat the antidepressant condition. Atypical antidepressant, this is a third category of antidepressant drug, and they are mainly used to increase the monoamine level in the brain, and they by inhibiting the reuptake, the reuptake of the monoamines will be inhibited. Okay, they will not get reuptake, or they will prevent the degradation. Okay, and the adverse effect are sedation, insomnia and agitation, and therapeutic effect are antidepressant. MAO inhibitor, they, as the name indicate, MAO, monoamine oxidase inhibitors, they will inhibit these enzyme, and they will increases the noradrenaline and dopamine and 5-HT levels. Adverse effect of orthostatic hypotension will be there, weight gain will be there, insomnia, cheese reactions will be there. This is very important. These cheese reactions, they are mainly produced by the MAO inhibitors. The antidepressant use and selective norepinephrine reuptake inhibitors are, they will block the serotonin or norepinephrine in the presynaptic terminal, and by binding to the SERT and NET receptors, and there the adverse effect are weight gain and insomnia. Antidepressant are the uses. Now, the third one is the antimania. As the name indicate, mania, it is a mood disorders, and these mania, it is a abnormally elevated mental state, typically which is characterized by the feeling of euphoria condition. There is a lack of inhibition, racing thought will be there. There is lack of thought, there is lack of diminish the need for sleep, talkative, the patient is more talkative, there is risk talking and irritability will be there. Mania, it is mainly caused by due to by use of some of the abuse or stimulant drugs, by consuming more and more stimulant drug, these mania condition will be there. And characteristic of the mania as antimanic or the antidepressant efficacy will be there. Okay, they will prevent the relapse or the recurrence of both. They will inhibit the manic or the depression condition. They are well tolerated and they are safer. Okay, drugs which are mainly used for the mania, the main important drug is the lithium. It is very important drug which is mainly used to treat the mood disorders. Atypical antipsychotic, anti-epileptic drugs which mainly include valproate, carbamazepine and topiramate will be there. Okay. Now if we talk about the these lithium, the mechanism of action of the lithium, it is mainly used, it is directly inhibit several keys which mainly regulate or recycling the inositol 1,4,5 triphosphate, okay, means the IP3, means these lithium, they will directly inhibit the IP3 pathway. This is the main mechanism of the lithium. If we talk about the, if we see this picture or this image, we will see that the lithium, it will comes to the receptor side and it will directly inhibit the IP3 and the DEC mediated signaling, okay, and these conditions, some of the adverse reaction will be there, some of the adverse effect which we'll see due to the lithium is the first one is the GI, means the gastrointestinal. In gastrointestinal it will produce a nausea and the vomiting in 2 to 3. First, if the patient is consuming the lithium in first 2 weeks or 3 weeks, they mainly suffer from the nausea and vomiting condition will be there. The CNS, fine tremors, obesity will be there, renal causes, there is some of the renal disorders will be there, there is unable to concentrate the urine, polyuria or polydipsia condition will be there, there is a diabetes insipidus condition will be there, structural kidney damage due to the prolonged use of these drugs, the structural kidney damage will be there, okay. Now there is if we talk about the endocrinal system, there is hypothyroidism, there is decrease in the thyroid gland or decrease in the T3 or T4 production will be there in endocrine due to the overuse of these lithium drugs, okay. Now if we talk about the CVS, cardiovascular system, they mainly produces the cardiac TV inversion will be there, cutaneous problem will be there, cutaneous means the pruritic or the, they may appear during first month of the treatment. If the patient is consuming the lithium in the first month of the treatment, they may be seen some of the cutaneous problem will be there, weight gain, 20% weight gain or more than 10 kg will be there due to the use of this lithium. Okay, again we will revise the adverse effect of the lithium. These are the adverse effect of the lithium. First one is the GI, gastrointestinal. What are the adverse effects seen in the gastrointestinal tract? Due to the first use in 2 to 3 weeks, they mainly produces a nausea and the vomiting condition will be there. Second one is the central nervous system. There are some of the effect which will be seen due to the use of these lithium in the central nervous system. There is fine tremors will be seen in the patient. In about 15 to 53% of the populations or the patient who are taking these lithium, there is a fine tremors can be seen. Renal, in the kidney, there is unable to concentrate the urine, there is a polyuria or the polydipsia condition will be seen, okay. Second one is the diabetes insipidus. They will, due to the this polyuria and the as you all know, in diabetes insipidus there is a condition, or diabetic mellitus, there is a condition of polyuria and the polydipsia condition will be there. So due to the use of these lithium, they mainly produces the diabetes insipidus will be there. There is a structural kidney damage due to the overuse of these due to the major use of these lithium, they mainly produces a structural kidney damage, okay. And now the effect which is seen in the endocrinal is the hypothyroidism. There is a decrease in the production of these T3 and the T4 due to the use of these lithium. They mainly produces the hypothyroidism conditions. CVS, central cardiovascular system, means heart. The effect which can be seen due to the use of this lithium in the heart, they mainly produces the cardiac T wave inversion. The T wave inversion will be seen in the heart. The cutaneous problem, due to the use of these lithium, there is a cutaneous condition will be there. There is a pruritic or the maculopapular rashes will be there. As I have already told you, some of the anti-manic drug, they mainly produces the allergic conditions also. Okay, they mainly produces the rashes conditions. Okay, they may appear after first month. Some of the patient who are using these lithium in the first month, they can see some of the allergic conditions in that patient. Okay, now weight gain will also be there. Now thank you.